Okay, we're gonna look at the skull on this one. Parietal bone will be here. There's your parietal bone, and we do have them on both sides. Okay, temporal bone, those are also found on both sides. The occipital bone is there. Okay, mandible, this is our jawbone. Okay, there's the mandible. Maxilla, the upper jaw. Zygomatic bone, those are my so-called Abe Lincoln bones. Zygomatic bone. Nasal bone. Vomer. Not that one, that might be, there it is, the vomer bone. Okay, there's your view of the vomer. Lacrimal bone. Okay, there's the lacrimal bone. And you can also fade the others so you can see exactly where it's at, and or isolate it by itself. Okay, ethmoid bone is in here. So let's fade others so you can see it. So there's the ethmoid bone. And then on top right here, superior view of the ethmoid bone, let's isolate it. You're going to see the cribriform plate, which is this part here. And then the holes that you see, those are the holes for the your smell nerves, which is your olfactory nerves. They go through those foramen there, through the cribriform plate. And then there's the crista galli, which is right here, that mohawk looking thing. Okay, so there's your superior view, and there's the crista galli right there, and cribriform plate. Okay, the whole thing is the ethmoid bone. Okay, sphenoid bone. Let's fade the others so you can see it. There's the sphenoid bone. Lateral view, anterior view, the other lateral view, superior view. And right here, let's isolate it, is the sella turcica. So superior view, so let's do that again. There's a view from the front, that's an anterior view. And now we're looking at the sella turcica, which translates to Turkish saddle. That's where the pituitary gland sits in. Okay, we'll learn about the pituitary gland in the nervous system lecture, but I do want you to know that the pituitary gland sits in the sella turcica. Okay, here's the frontal bone. And the coronal suture, which is right here. Coronal suture. It's where the frontal bone and the parietal bones come together to make the coronal suture, because it lies in the coronal plane. Okay, the lambdoid suture is back here. Okay, this is the lambdoid suture right here. Okay, it makes the lambda symbol, so that's where it gets its name. It's where the occiput and the parietal bones come together to make the lambdoid suture. Squamosal suture is here. Squamosal suture. Sagittal suture. It's this one here. It's in the sagittal plane, so this is a superior view. There's your sagittal suture. Okay, the nasal concha. So here's one of them. We do have 3 nasal concha, the superior, middle, and inferior nasal concha. Okay, you're seeing a view of it there. Now on a test, if I mark it, just tell me that it's the concha. Okay, nasal concha. Alright, the mental foramen is right here. Okay, so this area of the mandible is considered the mental area because of the way that if you think, thinking is a mental thing. So a lot of people will put their fist on their chin in this area, and like that famous statue of the guy thinking, he's got his fist resting on his chin part right there. That's considered the mental area of the mandible. And then here you're seeing the mental foramen. And the point of the holes in bone is for arteries, veins, and nerves to pass through. So that's the mental foramen there and there. Okay, the occipital condyles. So let's grab the occiput bone and let's isolate it. And right there, inferior view, there's the occipital condyles, and there's the foramen magnum, part of the occiput. Okay, the mastoid process is right here. There's your mastoid process. Later we'll learn that the sternocleidomastoid muscle embeds itself or attaches itself to that bone part. That's the mastoid process. Okay, supraorbital foramen. So here's our orbit. Okay, there's the orbit, and there's the supraorbital foramen, that hole right there. If you have a supra, you have to have an infra. So there's the infraorbital foramen right there. Okay, part of the maxilla bone. The optic canal is here. This is where the optic nerve comes through. So you can see that's cranial nerve 2. We'll learn about that in nervous system. Optic canal. Okay, superior and inferior nucleus. That is on the back side here. So you can see the superior nucleus there. Okay, superior nucleus. And then there's the inferior nucleus. And this distinct bump on the back of the occiput there is the external occipital protuberance, the EOP. The EOP, let's see if we can get a good view here. It's this spot right there. Okay, this entire area is muscle attachment site for trapezius muscle. It's also a great area to dry needle for that back of the skull, back of the neck, headache, pain. This area gets inflamed and responds very well to dry needling. Okay, the styloid process is right there. Okay, there's the styloid process, so let's isolate this so you can see a little bit better. Okay, it comes to a point, so that comes to a stylus point, so they call it the styloid process. External acoustic or external auditory meatus is here, still part of the temporal bone. Okay, so let's go back to the full skull. There it is there, the external auditory or external acoustic meatus, basically your ear hole. Okay, hard palate. So let's isolate this one and do this number there, and you're seeing the hard palate. Okay, this is inside the mouth. These are the holes that your teeth would go in, but that's the hard palate, the roof of the mouth. Okay, jugular foramen. And bear with me as I see if I can find this. Not sure if I can. It's going to be hard to get inside the skull here, if I can even do it. Okay, there we go. The jugular foramen. Okay, distinct holes that the jugular vein will go through, so the jugular foramen. Okay,